Hello, everyone, and welcome back to another episode of MI for Change. I'm your host, Dr. Monica Gilbert, and today we are going to talk about motivational interviewing in giving feedback about assessment results. And I'll share a little anecdote that I think will probably be relatable to some of you, hopefully, not a lot of you. When I started in this field, I was doing my doctorate, and one of the practicum sites, I actually had to do, well, obviously an entire psychological evaluation to a child that was diagnosed with autism. And when I was giving the feedback, I started off with, "Hi, I'm so and so." I asked the mom, I remember a little bit about how the child was doing, but it was very brief. It was more like just kind of like a little chat, a little icebreaker there. And that's it. I went into the results and I said, well, this is the IQ test. The working memory was below average, low average. The processing speed was also low. And I went on and on to talk about the IQ. And the way that I was explaining it again was very like clinical terms because one, I it was my first time. Second, I didn't have anyone model the correct way of doing this. And third, I wanted to make sure that it was clinical enough for her to take it serious. So that was my tone. It was a serious tone. I'm the expert here who went to school for all of these years. I know what I'm doing. And here I'm telling you what this is. That was my mindset. So I went on and then I said, "Do you have any questions?" And this is, as you know, a close-ended question and a close-ended, yeah, question. And of course, her response was a close-ended response, and she was like, No, I think I'm okay." And then I went on and I explained the rest of the things. Now, the difficult part was in the IQ. The difficult part was hearing about the diagnosis of autism. So then I go over the ADOS, which is what we were using. And at the end, I tell mom, well, your child is diagnosed with autism, whatever, level two, I think it was. And she was like shocked. And then I noticed that she had a shocked look on her. And I said, well, I noticed that you jumped a little bit when I mentioned this. Do you have any questions about this? Is there something that I can clarify? And she's like, well, my child has autism. Like, what do I do? And I said, well, ABA. ABA is one of the best treatments for autism and OT and speech. And then I went to give her all of these solutions to what she had asked me for, what I thought she was asking me for. And I even told her I provide ABA services in my company. Here's the number if you want to call. There's also other places you can call. You can call your insurance, blah blah. I gave her all those resources. And the beauty of this is that a couple of weeks went by and I was shocked. I was shocked that she didn't call me. And I said, I don't understand why this mom, I gave her all the information. I told her what she needed to do, and she never called me or any of my other colleagues, I think. So you're probably already thinking and you're analyzing this. And if you're very into motivational interviewing, you are pinpointing all of the wrongs here. And really, this came from a place of not knowing. I did what I thought was working and it didn't work. And that's okay because I think we all go through those patches and it helps us reflect. Hopefully, it helps us reflect because that's what allows us to then change. So it's important that we're all honest here. Most assessment feedback sessions are technically accurate, but they're also emotionally devastating to some parents. Some parents nod, others cry, others say, yes, I already knew. And it's a different type of grief or a different type of emotion, depending on where the parent is coming in that change cycle, too, or that acknowledgement cycle. So it's important that we not only learn to deliver these testing results and all of this with candor because it is important that we do so, but that we also work with the parent in this. Remember the spirit of motivational interviewing, we are establishing a partnership, a collaboration. And although I'm most parents will take a look at an assessment and not really know what a lot of these things mean. It's important that we are there to clarify it for them, but not in a way where I am the one that knows this and I'm teaching you, but more like, what does that mean for you? What is low average mean for you? Or let's take a look at the percentile rank. When it says that your child's cognitive abilities are better developed than 45% of peers, what does that mean to you? Because I want to know if the parent is interpreting your words and the results the same way that they're coming out. And that is very important. So, if we take a look at our traditional way of providing feedback, usually it's like the example that I provided you with. And you would say something like, based on the testing, your child meets criteria for, and then boom, you give that diagnosis. And this is more of that expert driven approach. It's not really like this collaborative approach. So here we are delivering data, we are delivering conclusions, we are explaining scores, and we are sometimes even defending the diagnosis. I've had parents that are like, "Oh no, that's wrong. That's completely wrong. I do not see that in my child." So instead of that, let's take this other approach. Let's ask, what do you make of these what do you make of these results before I share the diagnosis? So what do you make of these different categorical things that I found? What do they mean to you? Are these some things that you're seeing at home as well? And then what I like to do is that I like to go over the ADOS and the BASC and all of those results in combination. And then I ask the parent if this is something that they see at home, and I also go over the criteria for a diagnosis before I provide the data. So I'll say something like, is it okay if I share a little bit about what are the criteria or what are the things that have to be in the autism diagnosis, or the behaviors that a person has to engage in order for them to get this diagnosis? They say yes. I go ahead and I share away. And I talk about, the nonverbal communication, all that, and then the repetitive behavior. So these are kind of like the two things that we need in order to provide this diagnosis. And then I go over the results. And then I ask the parent and I said, what do you make of this? What are your thoughts about it? And usually just by asking that now becomes more of a collaboration. Like we're coming together to come up with this diagnosis, even though obviously the data already shows what it shows. So when you do that, when you are inviting the parent, then this now becomes a conversation, a shared understanding, not just a verdict. And that's what we want to do. Sometimes we have to deliver hard feedback, and we want to make sure that the parent is not defensive. And that is sometimes difficult. But I want you to think about defensiveness. And in the newest motivational interviewing research, and you'll see it in books and you'll see it in podcasts and articles, people are steering away from using this word of the parent is defensive. Instead we use more of this discord. So the word is discord, which means that in the relationship there's something that is just not working well, right? So it's the responsibility of the parent but also of the clinician to figure out what's going on there, why there's this lack of equilibrium. So again, we when a parent or when a person that we are speaking with is defensive, what does that mean? Why are they defensive? Usually when you're delivering hard feedback about a child to a parent and you are the professional, the parent tends to be defensive because of fear. They fear the unknown. They fear what's going to happen next. Where do I have to go? It's a real fear. Guilt. Maybe I should have done this earlier. Why did I take so long? Is it my fault that my child is like this? What did we do that was wrong? More so if you're a mom, because nowadays everything gets blamed on the mom, right? What the mom ate, if the mom took Tylenol, if, whatever, the refrigerator mom, everything gets blamed on the mom. But, anyways, guilt. Something else are threats to identity, right? So, who am I? Who's my child? And one big thing that I see happens is this loss of imagined future. As a parent, we all imagine our child's future. Whether we want to admit it or not, we just automatically do that. We already see their whole life, or we imagine the way that we would want to see their life. So when you give a diagnosis, you're kind of tossing that rock that wasn't really in the future, and it tends to crumble down. This imagined future now tends to crumble down. And now the parent is going through this process of grief. They are grieving the child that they thought they were going to have. And then much later comes the acceptance of what it is instead of what was imagined. But as you know, when you're grieving, that takes time. That's a process. It can be rushed. So behind this defensiveness lies all of this. When you start to think about it like that, not only does it allow you to have more empathy for the parent, but it allows you to see it as less of a fight. It's more of a, well, let's try to dig in and see how we can work together to lower this defensiveness, or to kind of help or alleviate some of these things that the parent is feeling. So, MI does exactly that. It allows us to reflect emotions before information. And usually, when parents feel understood first, they don't need to defend anymore. The hard feedback lands differently. And the message is, I'm here for you. I see you, and we can work together to go to where you need to go. It's not to find the solution, but go to where you need to go. And that lands way softer than anything else. So, the other part of this is that we want to evoke change talk around these assessment results. So sometimes you'll give the parent the assessment results and they're processing it, but what happens next? Just because you're telling a parent that their child needs academic accommodation doesn't mean that the parent is going to go and to the teacher and start working on the IP, get the tutoring, and start getting the academic accommodation. It doesn't naturally just translate to them changing their behavior. So when we are providing the feedback and the recommendations of our assessment plan, it's also with the intention that the parent will do something about it. I think as responsible clinicians, that's what we want to see. So we're saying, this is the diagnosis, these are the challenges, this is where you need to go. Now what? How do we help them get there? And sometimes it may feel like it can take an entire session just to do that. But there are little things that you can do within that same feedback session. And here what you want to do is really evoke that change talk. So based on these recommendations that I just shared with you, which one seems more feasible? What do you think would be the next step, or what is something that you can start doing, and what would that look like for you? Well, I have to go to my child's school and present the results to the teacher and really request that IEP. So you just walk them through it, right? And obviously, if they have any questions along the way, then you can help them with that. Um, it's really about asking those important questions. So, other important questions are, what feels most concerning to you right now? So, you just gave this parent the diagnosis, and maybe it's a multiple comorbid diagnosis, and there's tons of recommendations about all the different things that they can do. So, which one feels most concerning right now for you? Well, I think perhaps, the behaviors that are attributed to the autism, they're not allowing them to socialize. So, okay, well, what do you think are, if that is the most concerning of this, what are some things you can start doing to help your child socialize based on what we've spoken about? Well, you mentioned that social skills. Maybe I can start doing that. Okay. Okay. What part of this matters most for your child's future? Asking the parent that question. Again, we're linking that current behavior to the future expectations. Where do you already see strengths we can build on? And I love this question because I think that naturally, as we are giving feedback for an assessment, and really the reason for coming to an assessment is not unless it's a gifted assessment, but if not, the reason that brought the parent to this assessment was a challenge, was a concern that someone or they thought about. So naturally, this assessment is about all of the challenges that the child is having, and these are the recommendation. But for those of us who have done assessments before, you know that that also comes with strengths. When we do an IQ test, we are able to also see what strengths the child has. When we do a Vineland, we are able to see those strengths as well. So in all of these things, we are able to pull these strengths. And it's important to ask that question to the parent. Where do you already see strengths we can really build on? From the information I provided you with, what are some strengths that you acknowledge, that you saw? This helps evoke that motivation and that movement towards that change, which again is what we are intending for, which is what we want the parent to start doing. So, some closing reflections about this is that psychoeducational evaluations, psychological evaluations are powerful. They are needed. I always tell parents that I wish every parent can do this because that way we are able to acknowledge and really see what our child's strengths are, what their challenges are, how they think, how they process information, how they hold information. And that is pretty powerful in a very early age. If you're able to do that, that's great. That sets them up for the future. But sometimes when we deliver the feedback, sometimes when we deliver this, families walk away with this feeling of sadness, with despair. Maybe they're defensive, maybe they're frozen in their tracks, and other times they're activated and they're ready to go. Just know that the way that you deliver this feedback, that the way that you deliver these results can make that difference. So I hope that you found value as always in these sessions. And if you have any questions, please feel free to always contact me. Thank you for joining me on today's episode of MI for Change. If you're ready to keep growing your motivational interviewing skills, I'd love to invite you to explore my MI Academy, where you'll find a full library of on-demand courses designed to help you put MI into practice with confidence. You can learn more at www.drmonicagilbert.com. Until next time.